time, I'm delighted to introduce our sponsors this morning, who will speak about the state of healthcare here in Franklin County. First, representing Health New England, I'd like to welcome Michael Knapik. In February, Michael will be celebrating his second anniversary as Vice President of Government and Community Relations at Baystate Health. In this role, Michael is responsible for advancing Baystate Health's legislative and community agenda in support of the healthcare system's charitable mission. Prior to working at Baystate, Michael served as the director of the Governor's Western Mass Regional Office, where he reported on issues related to the constituents and communities of Western Mass. Additionally, Mike served as state senator for the 2nd Hamden, Hampshire district for 10 terms, and the state representative for Westfield and Montgomery for 2 terms. Michael, welcome.
Elizabeth, thank you very much, and Diana, thank you, and thank you for your leadership of this chamber community, and thank you all for being here today as well, and Happy New Year. I appreciate the opportunity on behalf of both Baystate Health and Health New England to spend a couple of minutes with you this morning, and I'm actually pitch hitting for Health New England because their leadership team is actually down in Boston with other health plans in Massachusetts, discussing obviously some of the challenges that are confronting the issues of providing care across Massachusetts, so they were not able to be here. Before I begin, a couple of remarks on behalf of Health New England. Let me also just recognize Hector Toledo, who was introduced a moment ago. Not only is he doing business as a part of the Greenfield Savings Bank team, he's also a trustee here at Greenfield Community College, appointed in the last year by Governor Baker, but he's also one of our trustees at Baystate Health. So he and his fellow trustees have the responsibilities for overseeing the largest public charity in Western Massachusetts. As Elizabeth pointed out, I do the government and community relations work for that largest public charity, and part of my role has been to intersect with local, state, and federal officials throughout the 4 western counties. And I can tell you, up here in Franklin County, and I know they're not here, but please report back the nice things I'm about to say about them, but you've got some incredible advocates for this county. I learned when I worked for Governor Baker in the last couple of years how important Franklin County was to the Commonwealth of Massachusetts. And what was unique about Franklin County was the extraordinary partnerships that exist in this county, represented by many of you in this room, your government partners at the local and state level, confronting every issue that our citizens need attended to. So I'm grateful for that, certainly as a former legislator. Now, on behalf of a health system with a health plan, very grateful for those partnerships. And the more we can do to advance that, we're grateful for that. Ron Bryant will speak in a few minutes about the extraordinary work that Baystate Franklin Medical Center is doing up here as part of a larger health system in Western Massachusetts. I do want to acknowledge our Vice President for Philanthropy and the Executive Director of the Baystate Health Foundation, Scott Berg, who is here, and our Senior Leadership Director, Kathy Bronner. And on their behalf, let me thank the generosity of this community. I mean, we rely on tremendous support from the public to help carry on the important work of providing health care to the citizens of this region. And without the generosity of individuals in this room and beyond, Baystate Franklin would not be able to carry on the work that it does. So thank you very much for that, and I know Scott and Kathy appreciate that as well. Baystate Health, just very quickly, it is the 3rd largest provider of care for the underserved in Massachusetts. Almost $250 million is our Medicaid portfolio. 67% is government paid. A large part is also Medicare. So we're one of the most heavily Medicaid, Medicare health systems in Massachusetts. So that's that intersection of working with your state, local, and federal officials comes into play, because they help us keep Baystate Health strong, and they help provide the insurance coverage and others for the citizens that are represented throughout our 4 western counties. So we're grateful for that, and you have a combination of new legislators up here with great passion and vision, and the dean of the delegation, Paul Mark, who I served with, who provides a very stable guide in terms of what we're looking for in the future. So I'm very grateful for that partnership of helping to keep Baystate Health strong. So moving quickly to Health New England. Health New England was established 30 years ago by a group of hospitals in the western part of Massachusetts and a group of businessmen and women who came together at that time to look at other ways to provide insurance for the employer community in our region. I won't go through the 35 years, but fast forward to today, Health New England falls under the portfolio of Baystate Health. Today represents about a $750 million entity providing insurance coverage. Many of you or your companies actually may have insurance through and with Health New England and our network of over 20 hospitals, dozens of providers as part of the fabric of what makes Baystate Health the entity that it is. There's only 3 hospital systems in the state with health plans, but it's allowed us to do some very innovative things on behalf of the citizens. So I apologize, I'm going to move to the notes for just a moment, and then I'll conclude and move on to Ron, and we'll talk about some of the exciting efforts going on. Last summer, Baystate Health welcomed a new president to Health New England, Dr. Marian Mcgowan, who has a national reputation as both an innovator and a healthcare visionary when it comes to looking at the challenges confronting the modern age of insurance and healthcare for the region. An example of the intersection of community health and business integration within Health New England in Baystate is what we call our Be Healthy partnership. I think some of you may have actually worked with us on that particular partnership, which is our Medicaid Accountable Care Organization, covering nearly 40,000 lives in Western Massachusetts. It's designed to provide different levels of care using clinical transformation tactics. They deploy transitions of care team, a pediatric intervention team, and ambulatory ICU and care teams that include community health workers, which is showing early success in reducing unnecessary emergency department admissions and improving access and health outcomes for the citizens. So we're very grateful and very thankful that much of that progress is being seen here in Franklin County. 2020 will be one of the significant transitions for Health New England as we accelerate the pace of change within which we adapt to the dynamic healthcare marketplace and evolving consumer need. The cost of healthcare is on the minds of everyone, so every day our people at Health New England are working to drive innovative solutions and drive costs down. H&E recently introduced a core suite of products giving employers more affordable plan options. RX saving solutions focused on managing pharmacy spend, behavioral health services through Teledoc, enhanced employer-based wellness offerings, and health share programs to share in positive medical loss ratios, all of which provide added value to employers. Health New England appreciates the hard work it takes to grow your business and to keep your people working. We're your local health plan, but we're also in the people business. Our mission is to improve the health and lives of the people in the communities we serve. Our people, your neighbors and your friends, will listen to you and work with you on what matters to you. Our people will make the complex simple, and our people promise to strive for affordability. And to that end, and in conclusion, if you'd like to meet with one of our Health New England associates, talk about the options that are out there, talk about literally the new product lines that are available in this transformational age of healthcare, give me your card after the session this morning, and I'll happy to pass it on. And with that, I just want to thank you for your attention. It is a dynamic, changing, transitional time in healthcare, and as citizens, we're all part of that. We're your local healthcare system. We want to be part of what happens in your lives. Any questions you have, please let us know, whether it's to our leader, Ron, up here in Franklin County, or any of the people at Baystate Health, and of course, our trustee. Thank you very much for your kind attention.
Thank you, Michael. And as Diana just pointed out to me, Health New England is our insurance provider at the Franklin County Chamber of Commerce. So our employees covered under Health New England, happily. So next, I'm pleased to introduce Ron Bryant, president of both Baystate Franklin Medical Center and Noble Baystate Hospital. Ron was recently welcomed to the Franklin County Chamber of Commerce Board of Directors. And demonstrates his deep commitment to our local community by serving on many other boards, including the Opioid Task Force Executive Board. Ron works closely with the Greenfield Community College community in an effort to deepen and strengthen the strong bonds necessary to ensure a well-trained and ready healthcare workforce. Ron, welcome.
Thank you, and certainly thank you for having me here this morning. Before I get going, I want to recognize a few of the folks that really make things happen at Baystate Franklin Medical Center. Sometimes I get too much credit, but these are the folks that really do all the good work. First, it's Cheryl Pascucci, who's a nurse practitioner that's heading up our Bridge Clinic and does a lot of work in the behavioral health area. Thank you, Cheryl. We got Maura Tobias, who is our Director of Community Relations for both Baystate Franklin Medical Center and Baystate Noble Hospital. Maura. We got Dr. Kishi Talati, who is our Chief of the Emergency Department at Baystate Franklin Medical Center. We got Dr. Baldor, who's going to say a few words in a couple minutes about the Family Residency Program. He is the new chair of the Family Residency Program that's coming to Greenfield at Baystate Franklin Medical Center. Welcome, Dr. Baldor. Becky George is here, who's our Director of Volunteers and pretty much shows up at everything, who does an unbelievable job with our volunteer program. The volunteer program that she has run at Baystate Franklin Medical Center is so successful that I dragged her down to Baystate Noble Hospital to implement it there in Westfield, and she has recently consulted with Greenfield Community College on their volunteer program. So thank you for all the hard work you've done in that area. And then last but certainly not least, the Chief Nursing Officer Extraordinaire and our Chief Administrative Officer for Baystate Franklin Medical Center, Deb Provost. So I'm going to touch upon a couple things. One, the economic impact that Baystate Franklin Medical Center and Baystate Health has on the Western Massachusetts and Greenfield and Franklin County. We sometimes take it for granted that we have a community hospital, but really, what does it mean to us to have a community hospital, and how important is it? And then I'm going to touch upon the social determinants of healthcare and the work that's going on in that area, because as we move forward in the future, a lot of the work that we do is going to be in healthcare. A lot of the work that we do is going to be outside the four walls of the hospital. You know, we're very good at taking care of folks that walk in through our front doors and through our emergency doors. In fact, we're exceptional at it. But as the future evolves in healthcare, it's not going to be within the four walls of the hospital. It's going to be outside the four walls of the hospital and in the community. And I don't think there's a community that I've ever been part of. I know there hasn't been a community that I've been part of, and I've been around a lot doing this all over the country for over 20 years, that really is involved as much as Franklin County in the social determinants of healthcare. But first, the economic impact and what it means to have Baystate Franklin Medical Center right here in our own backyard. As part of Baystate Health, first I'll touch upon Baystate Health. Baystate Health has 5 hospitals, one of which is a children's hospital. It has 6 urgent cares, 15 primary care sites, and this is one that I was really surprised at. I didn't know how big it was. We have 141 specialty practices. That's pretty big. 12 imaging centers, 31 labs, 3 health centers. We have over 1,000 inpatient beds, 1.8 million outpatient visits a year, 197,000 emergency visits, and 25,000 of those emergency visits are right here at Baystate Franklin Medical Center. Kishi sees most of them. 4,000 babies are born, and last year 476 of those babies were born at Baystate Franklin Medical Center, and I'm going to talk a little about one of their programs that they do there for opioid use disorder. We got over 12,000 employees, 24,600 jobs directly or indirectly supported in Western Mass by Baystate Health, and over 14,000 households are supported. What does that add up to? We're worth, to the economic output of Western Mass, $4.2 billion. It's not million, it's $1 billion. That's a lot of economic impact that we have as a system based on Western Massachusetts, and really with the support of all you, as Mike has mentioned, really makes all that happen. What is the impact of Greenfield and Franklin County of having Baystate Franklin Medical Center right here in our own backyard? Over 1,500 jobs directly or indirectly supported. 110 million of annual labor income comes from the organization. We support 891 households, 11 million in annual state and local taxes, and we generate 199 million, so 200 million in annual economic impact that Baystate Franklin Medical Center has on Greenfield and Franklin County. So it's pretty significant, and it really is a gem that we need to cherish as we go forward. Some of the most recent investments that we've made in the organization, we've put in a teletracking system, and for folks like me that are laymen, that are not clinical, what does that mean? It's kind of like a air traffic control hub. So all the patients that come into our system from wherever location, it could be another hospital, emergency departments, wherever, all go through this hub, and they manage the patients. And what does that mean for Baystate Franklin Medical Center? That we are now able to receive patients from other regions, mostly from the North Quabbin region, southern New Hampshire, southern Vermont, that go directly now to Baystate Franklin Medical Center for their care. And they bypass Baystate Medical Center, which is down in Springfield. So it allows us to grow as a medical center right here in Greenfield and see more patients. After it was implemented in the first 3 or 4 months, we've seen over 70 patients through that teletracking system right here in Greenfield that we wouldn't have normally seen. So it allows us to expand our services as a community hospital, which is what we want to do. We've recently put in patient lifts for our nurses, which allows them to more easily care for our patients. We have expanded our 3D mammography services. We are now implementing, actually in construction, we're in phase 2 of our behavioral health pods in our emergency department that allows us a safer and more quality environment for these behavioral health patients that we see in our emergency department while they're waiting for transition to the appropriate level of care. And we are now looking at, it's in progress actually, is to renovate our endoscopy recovery area, so we'll have a dedicated recovery area for the endoscopy patients we see. We perform over 300 endoscopy procedures a month. So that's pretty good for a community hospital, and we have it where we will now have a dedicated recovery room for these patients. That was kind of an offshoot of building a new surgery center about 4 years ago, which is probably old news by now, but it's an unbelievable surgery center. I can't tell you how lucky we are to have it. And then the second phase is now to build recovery rooms from the old area that used to be there for the endoscopy. So, what I'd like to talk about a little about is the work of the social determinants, which is so important to us, and really the work of the community that has made this happen. The first one is the Empower program, and this is a program that we received a $1 million grant for Moms Do Care expansion. And the purpose of this is to expand the services by creating a medical behavioral health home model for women with perinatal opioid use disorder. Baystate Franklin Medical Center, in collaboration with the Franklin County Perinatal Support Coalition, created the Empower program for women in 2015. It's a comprehensive screening and referral program to promote access to services and provide care to women and their families affected by perinatal opioid use disorder. So this new round of funding will be utilized to expand the current services by providing case management and creating a newborn clinic to follow babies through the 18 months of life and providing peer mentors to offer support and care coordination. I can't tell you how important this program is and how important it is to our community. The work that they do is phenomenal. It's really a nationally recognized program right here in Greenfield. So I want to thank them publicly for all the work they do. The second is a bridge clinic, which is really the brainstorm of Cheryl Pascucci, who's done a tremendous amount of work on this. We recently received a $1 million grant to address the opioid use disorder with prevention, intervention, treatment, and recovery spectrum in Franklin County and the North Quabbin region. A primary barrier is the inability of the individual to make a crucial connection between themselves and the services they need to get well, and then coordinating those services over time. To address this critical and life-saving gap in services, Baystate Franklin Medical Center, in collaboration with the Opioid Task Force and other consortium partners, created the Franklin County and North Quabbin Region Bridge Clinic. The The Bridge Clinic team members will be mobile and available at multiple different access points in the region to work with people suffering from or at risk of opioid use disorder. The goal is to meet people where they are, including Baystate Franklin Medical Center Emergency Department or our inpatients, in a host of community-based settings such as peer recovery centers, libraries, high-density housing areas, etc. Self-referrals or referrals from family or friends will also be encouraged because the home is the most convenient site for the engagement. By offering a range of these services, the Bridge Clinic will increase prevention, treatment, and recovery in Franklin County and the North Quabbin area. This is a big deal, and I got to thank Cheryl for all the work that you've done on this. This is a tremendous program for this region. Next, I'd like to talk about the family residency program. I'm going to introduce Dr. Robert Baldor, who is the chair of this program. This is the first academic medical program that is not going to be on the campus of Baystate Franklin Medical Center in Springfield. When it was decided, and it was decided out around the table between me and 3 other doctors, that it was going to be here in Greenfield, I couldn't hold my excitement in. I was just going to ready jump for joy that we decided it was going to be here. So if you want to say a few words, Dr. Baldor, wherever you'd like.
So good morning, and you know, I think you heard earlier that as things begin to age, the foundations start to crack and wrinkle and so on. Well, that's actually what's been happening with primary care, and primary care is really the foundation for a really robust, healthy community and really helping to support a community hospital. You need that. So what family medicine is, these are primary care docs. It's going to be a training program here in Franklin, here at Greenfield Medical Center. We're bringing in medical students, young docs, to learn about family medicine here and hopefully stay. That's what we're trying to do. You certainly have heard people talk about the fact it takes a village to raise a child. I'm fond of saying it takes a community to train a family doc, because what we want these family docs is to be aware of things like the social determinants of health that you were talking about. But what does that mean for a physician who's well trained to take care of appendicitis? How do they also think about those things? And that's what I will be interacting with a lot of you over time, saying, how can we work with you? How can I get my residents some exposure to the community programs that are out there to tie them back for what the patients need? The other part of it, what it takes, is we're bringing in young learners into this community. They need to be welcomed into this community, to thinking about living here, raising their children as part of that. So lots of excitement that's going to play out here over the next couple of years. And the final thing is this is going to be an interdisciplinary training health center that we're building. We're going to train these young doctors to be really superb primary care physicians, but we're also going to train nurse practitioners and advanced practice PAs and psychologists, and reaching out to the community college here to say, can we get nursing students involved as well? So this is a resource for the community, and you'll probably be seeing me more as I float around. So thank you for a minute just to sort of say hello. I will lose the tie next time I come because I wasn't sure what to wear here. I actually grew up in a little town in Vermont, so I feel great here. When I was at the Franklin County Fair here earlier this year, I went to the oxen pull, and it felt like just back at home. So I'm thrilled to be here. Thank you.
Thank you, Doctor. That's a big deal. You know, there's a saying that, the high tide will lifts all. That is one tide that we want to keep having come in. That's going to really lift what we do at Baystate Franklin Medical Center for years to come and give us access to primary care because it's much needed. I just want to mention a couple other things in the Social Determinants of Health. We have a committee at the hospital called CBAC. It's the Community Benefits Advisory Council, and they do some tremendous work. And really, it's headed up by myself, but all the work, it gets done by my co-chair, Phoebe Walker, who works for the Franklin Regional Council of Government. She does unbelievable work with us. And some of the things that have come out of there recently is, where's Mary McClintock? She's here. Yep. The look for help. Yep. So there's a little card. I'm going to give her a shout out. There's a little card on your desk. And really what this is an app. that was developed with funding that came out of this committee. And what it allows you to do is look up things for like housing, food, transportation, mental health, addiction and recovery services. And one of the uses we want for it is for our case managers and our social workers within the hospital, where they can just go right to an app and say, okay, what types of services do I need for my inpatient right now, and be able to give that service to the patients. Doesn't necessarily have to be an inpatient, but anybody can use it. So we encourage you that for your organizations, that pass this along to your employees, that so they use it, because we want a lot of activity on this, because we're going to have to keep the funding going so that we can keep this up and running. But it's huge. This is a great opportunity for us to connect the services in the community. So Mary, thank you for that.
It's actually a website. It's not, it is used, you can use this on your smartphone, but you can use this on your smartphone or tablet or computer. It's a website, www.workforhelp.org. If you do .com, you'll find a great app for a South African phone company. Workforhelp.org. But definitely, especially, this is for everybody. We've got new services for everybody, but particularly I'm thinking about employees that businesses in Franklin County have. Make sure everybody knows about this.
Perfect. See, public speaking is really easy. You just recognize everybody that's doing the work and let them tell you about it. Do you have you?
Curious, I'm a member of the community. My name is Susan Louisiano, and I have a small real estate appraisal business, but I was the first director of special ed for Mohawk. I'm currently on the board for the only long-term psych unit at Vibro. We're the only ward left open in the hospital. I was on the NAMI board for 8 years for Massachusetts, and I'm encouraged to hear about all this community development and growth. And I'm wondering, does that mean that you're going to be leaving the mental health acute care units in place at Franklin?
Geez, I would have been surprised if that didn't come up while I was up here. Gee, thank you very much. Well, there's only so much that I can answer about that, but I can tell you that we are, as an organization, extremely concerned about what is going on with the behavioral health, and in particular, the lack of beds in Western Massachusetts. Recently, in the last couple of years, Providence Hospital, which is a large behavioral health hospital down in Springfield, has closed their child and adolescent beds. I think they decreased their beds by 24. There is concern about the Brattleboro Retreat facility up in Brattleboro, Vermont, which certainly would have an impact on our area. And the amount of beds that we have in the capital and the resources needed to run those beds and expand those beds allows us to look at other ways to make it better for our patients in Western Massachusetts. And that's our concern. That's our number one concern, is how do we serve the patients in all of our communities the best possible way. And that's what we'll always look at. What is the safest, most highest quality way to serve those patients? And if that means that we have to come up with a new hospital, then that's what it'll mean. What we want to focus on, and really, is that, and this is, I don't spend a lot of time on this, but really the prevention of behavioral health is a thing that we really want to go forward in the future. That's why you work on things like social determinants of healthcare. The answer is not to keep folks in the inpatient setting. The answer is to take care of folks in an environment before they get to the inpatient setting, which is why we develop things like the Bridge Clinic, why we work so closely with the folks on social determinants of healthcare, because we don't want you to be a patient in the first place. Does that mean we can eliminate inpatient altogether? No, it's not. That's almost an impossibility. But we can focus in the communities on providing the outpatient services that folks need. And I think that's where you'll see, when I talk about the future of healthcare moving with outside the four walls of the hospital, is how do we develop those services in the community that are going to address the outpatient side before they become inpatient. And I think that's where you're going to see a lot of the work in the future be done in our community. So I know that wasn't the answer you wanted to hear, but it is what it is at some times. And I just want to mention one more thing. We recently, Baystate Health received a $4 million Life Science Grant Award, and this is really to build clinical trial units at Baystate Medical Center, and with the help of Representative Paul Mark and Senator Joe Comerford, we're also going to put a satellite lab up here at Baystate Franklin Medical Center for these clinical trials. So this allows us further research and clinical trials in our own backyard and really in all of Western Massachusetts, and allows us to partner in the future with Greenfield Community Colleges on the life sciences. So this was something that we were very excited about, and we were awarded this money about a year ago. And it's Dr. Peter Friedman, who's our Chief Research Officer, heads this up. So you'll hear more about this going forward in the future, but we were excited about that. So with that, I think I'll end there, and thank you for your time.